Every year there are changes to original Medicare Part A and Part B that affect how our out-of-pocket expenses will be handled during the year. So I'm going to go through that right now for 2023. And I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. I can absolutely help you as well. Right now I'm going to talk about the changes in original Medicare for 2023. And it's really not that complicated, but we want to understand exactly how things work so that we can maximize our benefits in Medicare. So with original Medicare, it's Medicare Part A, Medicare Part B. Part A covers things that happen in the hospital when you're inpatient admission to the hospital. Part B covers things that happen outside the hospitals, doctor's visits, specialist visits, outpatient surgery, things of that nature. So they both have deductibles, they have co-pays, so we want to make sure we understand exactly how they function so that we can maximize the best value within our Medicare. So Part A, stuff that happens inside the hospital when you're admitted into the hospital. It has a pretty big deductible. In 2022, the deductible was $1,556. So if you're admitted into the hospital, you'd be responsible for that amount pretty much immediately. Now in 2023, it's going to go to $1,600. So it is a slight increase of about $44 for the year. Now understanding that deductible is it's per admission. So it can happen more than one time during the year. There's a 60-day window for the same condition where if you were readmitted, it would not happen. But outside of that, if you were admitted again past 60 days for the same condition, or if you're admitted for a different condition, you're going to have that $1,600 deductible again. Now, the good part is if you have a Medicare supplement plan, just about any Medicare supplement plan covers that deductible in its entirety. So really no out-of-pocket expense if you have A, B, and a Medicare supplement plan. You really won't have a deductible if you're admitted into the hospital. So certainly a good reason to have a Medicare supplement plan. Now, when you're in the hospital, day 1 to 60, there is no copay. So if you're in the hospital for less than 60 days, and hopefully we're in the hospital for less than 60 days, there is no per day copay. If you happen to be in the hospital longer than 60 days, from 61 to 90, it was $389 a day. A lot of money. It's going to go to $400 a day. More money. So not a significant increase, but certainly an increase. And again, a Medicare supplement plan, just about all of them cover that in its entirety. So you really would not have out-of-pocket expense in that situation. Now, skilled nursing is a separate piece. So if you're admitted into the hospital, and this is important to understand too, as inpatient, you need to be classified as inpatient to qualify for skilled nursing care, and it has to be an inpatient admission for longer than 3 days. Now, sometimes hospitals will admit you for observation, which would not qualify you for skilled nursing upon your release. And when we're talking about Medicare and skilled nursing, it is strictly for rehabilitation, where you're going to make improvements. So for instance, if you broke your hip and you're in the hospital for a week, and they're going to release you to a skilled nursing facility for rehab so you can get back on your feet and be comfortable going home, that is part of what is covered under Medicare. It is not designed for things like long-term care. So for things where you are not going to show improvement, it has to be for rehabilitation for skilled nursing. So under Medicare with skilled nursing, day 1 through 20, there's no copay. So there's no cost for day 1 through 20. If you were there for longer than 20 days, it does provide coverage up to 100 days. And day 21 to 100, it was $194.50 per day. Again, a lot of money. It's going to $200 per day in 2023. Not a big increase, but certainly still an increase. And again, most any Medicare supplement plan covers that in its entirety. So Part A deductible, Part A copayment, skilled nursing facility copayment, pretty much all of it is covered under a Medicare supplement plan. So for any of that, you'd have really no out-of-pocket costs whatsoever. And certainly That's terrific health insurance. So that's kind of what we want to accomplish when we're coming into Medicare. Now, when we talk about Medicare Part B, back to Part A for just a minute, there is not a premium to Part A for most people. As long as you have worked your 40 quarters during your lifetime, you qualify for Medicare Part A without a premium. So there's no cost monthly to have Medicare Part A. Part B is a different story. There is a premium to Medicare Part B, and it's important that we understand that. A lot of people don't understand that when they first come into Medicare. So Medicare Part B premium 2022 was $170.10 per month. And the way the premium works is if you're drawing Social Security, it's going to come out of your Social Security check. So it's convenient, at least, that it's going to come out monthly of your Social Security check. If you're not drawing Social Security, and this surprises a lot of people, they're going to send you a bill. And they're not going to send you a monthly bill. They're going to send you a quarterly bill. So it's going to come with a balance due 3 months at a time. So you need to certainly be prepared for that if you're not drawing Social Security. Now, the good news is premium for 2023 is going to go down some. So it was $170. Now it's going to be $164.90. So certainly a welcome sign that it's going down a little bit. There's some reasons for that. Won't get into that right now, but it is less than it was in 2022. And again, if you're drawing Social Security, it's coming out of your Social Security check. If you're not, they're going to bill you quarterly. So you need to be certainly prepared for that. Part B also has a deductible, like Part A has a deductible, except it's much smaller under Part B. So this is stuff that happens outside the hospital, doctor, specialist, outpatient surgery. And in 2022, the deductible was $233 for the year. So again, small deductible, but still, it's out-of-pocket money. And for 2023, it's going down also to $226 for the year. Now, most supplement plans, pretty much any supplement plan now, will not cover that deductible. Plan F used to cover that deductible, still does if you have Plan F, but if you're coming into Medicare now and you turn 65 after 2020, Plan F's not available. So you're going to have that deductible. And again, it's one time. So it doesn't happen multiple times. It's simply one time. You're going to be responsible for the first $226 for the year. Now, that's kind of a pretty good synopsis on how Medicare works. Now, Part B also has a 20% coinsurance. So Part B, Medicare, when you go to the doctor, the outpatient, the specialist, they're going to pay 80% right off the bat after that deductible, and then you're responsible for 20%. Now, most Medicare supplement plans cover that 20%. So if you have Part A, Part B, a Medicare supplement plan, chances are, if you have Plan G, your entire out-of-pocket expense for the year is that Part B deductible of $226 for the year. And then it's going to pay 100% of your medical expenses for the rest of the year. So super fantastic coverage. If you have Plan M, you still have that deductible out-of-pocket, $226, and then you would simply have a copay of $20 when you go to the doctor, $50 if you go to the emergency room. So it's really pretty fantastic on the out-of-pocket expense as you go. Now, Part B premium and also Medicare drug plan premium are income-based. So that means if you make more than a certain amount of money in income, you're going to pay more on your Part B premium and your Part D premium. So it's called IRMA. And the line last year, 2022, was if you make more than $91,000 individually or $182,000 filing jointly, it's going this year to if you make more than $97,000 individually or $194,000 jointly, you're going to pay more. And the more you make above that, it's going to make your Part B premium more as well. So it's all related. And I have a video right on that. You can see I'm going to post it right up here. If you want to watch the IRMA video, if you make more than that kind of income, it'll show you the breakdown exactly how much your Medicare premium is going to be. So certainly important to understand. And I hope you found all this helpful. I'm certainly happy to help with any of it. The best part about it is there's no cost to allow me to help you. So if you're going to have Medicare Original A and B and you're going to have a supplement, that's what I do. I help people get the right supplement at the right price in your zip code. And we're licensed in all 50 states. We're there to help with everything that you need now and in the future for Medicare. So I hope you found this helpful. Stay tuned. I'll show you how to download my book for free right now, Medicare Made Clear. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll find very helpful is, first, download a copy of my free book, Medicare Made Clear. I put a lot of time, a lot of effort into this book. You'll find it very helpful for everything that you need for Medicare now and in the future. It has videos in the book, has all the links that you need for signing up and everything else that you'll need going forward. So take just a minute, go to MedicareOnVideo.com/free book. You can download it right now and save it on your computer. You'll have it for now and in the future. And then down the road, when it's time to renew your Medicare supplement plan, we always want to shop around. So every year, it makes sense to do a Medicare price check. And I have a website specific to that, www.medicarepricecheck.com, where we will compare your current plan and see if we can get the same plan at a lower price. And a lot of times we can do that. So it makes sense to visit medicarepricecheck.com every year. We'll do a quick comparison, let you know if it makes sense, and then we take it from there. I hope you found all this helpful. Have a fantastic day. Hey, don't go anywhere. These are some of my most recent videos right here. You can also find the link right below this video to download my book, Medicare Made Clear, absolutely free. You can also subscribe to my channel right here. So please download my book, watch some videos, subscribe to the channel. Have a great day.